I feel betrayed by the nursing home and by government, because we're paying good money for them to look after her, and they weren't doing that. And even before this pandemic, they weren't doing a very good job.
We need a bold vision, we need action, and people keep telling us over and over again, they want to be at home as long as possible.
Denmark, which really takes elder care seriously, has invested massively in home care. They didn't have a problem because they had a system.
I think we need to invest in our personal support workers. We need to invest in our caregivers, and we need to look at possibly putting home care first as an alternative to long-term care.
Home care is an array of services readily available, person-centered. It's not siloed. You can choose what you need and what will best suit your needs at home.
I think we treat our pets better than we treat seniors. I think it's pretty sad.
From the Zoomerplex in historic Liberty Village, the Zoomer with Marissa Lennox.
Welcome to the Zoomer. I'm Marissa Lennox. If we've learned anything from COVID-19, it's that we didn't have a real plan in place for seniors in long-term care, in spite of advance warning from other countries. As we move forward, and as governments work to provide solutions for long-term care, where does improved home care fit in as part of that discussion? On today's panel, we'll explore whether provinces ought to do more to keep seniors out of long-term care facilities in order to enable them to live at home. But before we dive in, let's tee up the topic.
Canadians want to age at home, and if COVID has done anything, it's reinforced that desire. But many fear a lack of publicly funded home care services will keep them from doing so in the future. In a recent CARP survey, 68% are not confident that they will receive adequate home care supports, while a quarter compensate with private home care services. Another 60% worry about insufficient training of support workers. In a separate survey, nearly 20% of people admitted to long-term care had mild or moderate needs that could have been met at home. With 4 out of 5 COVID-19 deaths in Canada linked to long-term care, it's never been more vital to invest in care at home.
Dr. Young, earlier this week, a report from Canada's military operating in long-term care was released, and it revealed just unconscionable examples of resident neglect and abuse, a total breakdown of infection control, infestation of cockroaches. You know, was there anything in this report that you were surprised by?
I mean, sadly, we were all very shocked to see it all in writing and to see it in front of us. You know, many of us have known for a long time that long-term care homes are not as well resourced as they could be. And we've been doing a better and better job of trying to support people at home and trying to keep people out of long-term care facilities. But what that means is that the individuals that go to long-term care facilities are even more medically complex than they ever have been in the past, which stretches the resources very, very far. And I think we're seeing a result of a system that's stretched to the max, and very sad to see, but very thankful that we can finally focus some attention on this very well needed area, and looking forward to the conversation today to talk about how we can move forward and how we can do a better job of of all of our older adults that are in long-term care facilities and trying to keep them at home.
Andre, same question. Anything in this report that you were shocked by?
Well, unfortunately, no. As you heard, we've known of these problems for a long time. I think it took some outside eyes. It took the military going in to remind the public that this is how serious this is in some homes. So I think that was a welcome. I think the timing is important. This is a population that's easy to forget and easy to neglect. They're sort of hidden away. They're voiceless. They don't have people advocating for them too much. So bringing in an outside group and giving them the opportunity to say, oh my God, this is how awful it is. I think it really shocked the public, and hopefully it'll shock our politicians and our policymakers into action.
You know, Miranda, one of the things that I was shocked by was, in spite of the fact that the military was actually in these homes, there continued to be neglect and abuse, as if the care workers were totally impervious to their presence. I mean, what does that say about what's going on in these homes and the culture that exists in these homes?
Well, you took the words right out of my mouth, Marissa. I think that there has been an accepted culture of abuse in these long-term care homes for far too long. Like the other panelists said, we were definitely not surprised by the findings in the CAF report. We were obviously devastated. To see it in front of us on paper is one thing, but I can tell you that personal support workers in my membership and the association have been crying foul about long-term care homes for going on 10 years now. So it's actually a welcome document, and I truly hope that we now see the change that needs to happen.
Well, you know, we keep talking about change, and now will be the moment in time when we finally fix long-term care. But you know, I feel like we've been here before. I feel like we were saying the same things just a year ago after the Wettlaufer inquiry. Lisa, do you have any thoughts about, you know, is now finally the moment when real change will happen?
Well, we're hoping that Corona has brought a light to the need for home care service. As you know, only 4% of the provincial funding is allocated to home care services. And especially in a time like this, people were afraid of the transmission from person-to-person contact, but it was these congregate settings where it just exploded. And we need more attention put to home care, and it needs to be made a viable option.
You know, one of the big things that continues to come up, Andre, is, you know, a conversation around well, not just staffing, but standards. And there are some standards, and let's take Ontario, for example, in the Ontario Long-Term Care Homes Act, that are being ignored. You know, what do you do to address the fact that not only do we need to ensure that the standards that are existing are adhered to, but also we need to raise those standards?
Right, so there are standards, but they have to be monitored, right? So we have to do proper inspections. These homes undergo all kinds of inspections, but they don't seem to be in any organized manner. So the fire department comes in, the food service, food inspectors come in, the ministry inspectors come in sometimes, but a lot of it is complaints based. So we wait until the problem is so severe that there are complaints, and then somebody goes in. So it has to be more proactive. There has to be a greater expectation that the rules will be followed and that there will be consequences if they aren't, and there rarely are any consequences. And there has to be, I think, a way for the people who live there. The residents are very vulnerable. They can't always express themselves. There have to be people standing up for them. So there's a lot of shortcomings there that make it easy to come to this point where we have this kind of neglect.
Well, and Miranda, you know, we also learned that inspections were being performed by phone. I mean, how do you spot a cockroach over the telephone?
Well, you don't, and it's ridiculous. And, you know, I think there's so many excuses. I mean, let's be honest. There's been excuse after excuse and excuse after excuse going on years now in relation to long-term care facilities. There's not enough investigators, and there's too many investigators. And then, well, we have to save money by only doing this or doing that. The time for excuses and panels and research is over. We know what we need to do to fix a long-term care system. So I say we start acting now.
All right, we need to take a short break. We'll be right back with more of the Zoomer.
Truly, there's not enough personal support workers in order to do this job. And now with the COVID-19, home care has been neglected.
Welcome back. Home care has been a missing piece in this pandemic. But when it comes to being able to stay at home, the ultimate challenge is around human resources. With what we've seen transpire in long-term care, should provinces be doing more to improve home care, not only for an aging population, but also for residents who choose to leave their home to live with a family member during a pandemic? Lisa.
Well, definitely, you know, that I agree with this 100%. We need definitely better care plans for people leaving the hospital with chronic conditions, recovering from an injury. After these elective surgeries, they need to know what's available. Home care is an array of services readily available, person-centered. It's not siloed. You can choose what you need and what will best suit your needs at home and in the security of your home.
You know, Dr. Young, we know that the majority of residents of long-term care have some form of cognitive impairment. And dementia is a particularly difficult illness, I think, to take care of. And so I guess my question is there will always be a place for long-term care, but is it realistic to expect that we might be able to meet some of the needs of these types of residents, people potentially with cognitive impairment, perhaps they have mobility challenges, so on and so forth, at home?
So I think it's very realistic that we can do that. In fact, the way that the home care system is set up right now is it really caters to people that have physical healthcare problems. And so, for example, you often need to have some sort of physical needs, such as needing assistance for bathing in order to qualify for home care. But people with cognitive impairment often need other types of services to make them successful in being able to live at home, especially if they're independent or if their caregiver has some medical needs of their own. So, for example, they might need somebody to help them get some groceries, or somebody to help them to remember to take their medications on a regular basis. And so if we start to realign the home care system to actually sort of realize what patients' needs are and to really look at it in an objective way, instead of just putting people sort of into the buckets that previously existed, then I think we have a real chance of being able to both keep people at home where they want to be, but also to contain some of the healthcare costs. And so it's really a win-win for both sides.
Miranda, where's the breakdown in all of this? Because we know that the needs of home care patients are not being met. I hear from people fairly regularly who say, I need more hours, even a couple respite hours, but you're not allowed to take them all at once. It has to be split up throughout the week. Maybe you get an hour on a Monday and an hour on a Wednesday. That's barely enough time to get to and from a grocery store. So, what are the biggest challenges in home care delivery?
Oh my goodness, that's a loaded question, Marissa, honestly. I mean, home care in itself is the wild, wild west. You have the public companies that receive direct funding from the government in order to give the free care to Ontarians. And then you have the private home care companies that are typically the franchises that do direct care to the client. I think one of the major issues that we see here is that the client does not have enough control over their care needs. We hear from many families as well that reach out to us and say, why can't my mom get more than 2 showers a week in home care? Why can't dad get a more than one visit a day just for his medication for 1 hour? And really, there's many different reasons for that, Marissa. Truly, there's not enough personal support workers in order to do this job. And now with the COVID-19, home care has been neglected through COVID-19. No focus has really been on this. And I can say it because I sit on the Emergency Operations Committee. Home care in the beginning, we all thought that COVID-19 was going to hit home care first. Thankfully, it didn't. Unfortunately, it went into our long-term care facilities. We see home care companies that have lost 30% revenue and clientele. Personal support workers are going off and taking CERB as opposed to working the front line because there's just not enough hours in home care. This has been truly a wake-up call, not only in long-term care homes, but I really think on the home care front.
Well, and Andre, what's going to happen post-COVID with PSWs in home care? We know that there's a struggle to obtain human resources in this space. And, to what Miranda just mentioned, many are fearful of returning to work. Maybe they look for a different line of work for that matter. We continue to hear that there will be, a second pandemic of mental health issues associated with COVID-19. If you had a crystal ball, what's your prediction?
Well, we have to put the focus on the workers. Healthcare is a hands-on business. We need to remunerate them properly, not these temporary raises during a crisis, but pay them, ensure they have full-time jobs with benefits, all this. And then I think it's a philosophical question we have to address. We have to say, how do we get the right care to the right person at the right time? Whether it's, what do they need today? Do they need home care? Do they need a residence? What do they need? And start from that. We have a structure where the Ministry of Long-Term Care is essentially the Ministry of Nursing Homes, and home care is something else entirely. It's not mixed together properly. You don't you don't get to choose where you want to go. You end up in places by default, and that's not the way a system should run. It's not patient-centered. It's the antithesis of patient-centered.
You know, Marita, actually, one of the questions that I have is, you know, it was big news when the province took steps to limit care workers to one long-term care home. Did that same thing happen in home care? Because we know that there's tons of PSWs that go from home to home to home. And to what extent has that impacted the spread of the virus? I mean, has COVID hit home care?
As far as we're aware, no, it has not hit home care. And thankfully, let's all knock on wood right now for that, because in home care, it'd be very difficult for us to isolate that. What we saw many PSWs actually who were working in long-term care and in home care as a second job, because they didn't have full-time in long-term care, choosing to actually go into long-term care and remain there and not work in home care. So we saw a huge decline of personal support workers on the front line in home care. We saw clients now, even still now, not receiving any care, families crying out for any sort of help, PSWs not wanting to go into, not wanting to work because they're afraid of losing their lives. I mean, let's go back again to the conversation, Marissa, of PSWs were never deemed essential, and now they're deemed essential. We're expecting, and it's a very huge burden of a responsibility on a non-essential, now essential worker. So we have to be honest about what we expect from personal support workers.
All right, that's a great way of putting it. We'll be right back in a few minutes.
Where were the government inspectors to inspect these nursing homes to come up with this finding earlier? This should not have taken the military to go in to do that.
With the number of deaths in the country's long-term care homes at a shocking level, many Canadians that were able to have opted to pull their loved ones out, including Toronto police officer Dwane Simon, whose 90-year-old mother, who also suffers from dementia, was a resident at Orchard Villa, one of the province's hardest hit homes. We're heading over now to join Dwane and his mom as she gets in her daily exercise over at her son's condo.
I get her to walk hallways, right? And this is her exercise. I used to have a little bicycle for her, a little pedal. 3, 4, but she doesn't like that too much. This is her jog along the lake shore. I decided to take her out because when 8 staff had tested positive, I knew that her level of care would have dropped significantly because it wasn't the greatest to begin with. It was very bad.
1 minute.
And when I got her home on the Wednesday, I got a call 2 days later on Friday telling me she was COVID positive. She was asymptomatic, no symptoms. So I had to isolate with her for 14 days.
So she didn't have any symptoms?
No, she didn't have any, nothing, very, very mild, or mild to none. As you see her right now, she's walking, she's running.
She's moving fast, yeah.
Slow down. Hold on 1 second.
And how has this been for you?
It's not easy. I mean, I'm getting help now from some family, but it's to the point where I know I'm going to be retired. I have to retire early to do this. There needs to be a public inquiry into nursing homes and how they were run and how this whole pandemic was handled. And also, I think that the government should take over management of nursing homes. For-profit nursing homes got to go. The seniors are the most vulnerable in our society, and we have to protect the seniors. If this was a daycare, this would never happen. If these were children, I don't believe that society would ever stand for this many children dying in such a short period of time. So I think there needs to be some major changes.
For more stories like Dwane's and the latest facts on COVID-19, including videos with experts and more, visit carp.ca. In Toronto, I'm Darren Maharaj for Zoomer News.
Dwane joins us now at the panel. Dwane, thank you for taking the time. Now, your mother was in Orchard Villa, one of the 5 homes reported about in the military report. How does this report leave you? Were you shocked by the findings?
I wasn't shocked at the findings because I've been trying to sound the alarm on nursing homes for a while now. I wasn't shocked. I was more disturbed that it took the military to go into a nursing home to file this report. I strongly feel that where were the government inspectors to inspect these nursing homes to come up with this finding earlier? This should not have taken the military to go in to do that. So I'm not shocked because, you know, I know what it's like in these nursing homes. And I think that once this pandemic broke out, given the fact that there have always been shortages with staff, that the government should have put inspectors into these nursing homes to see that there's adequate care being provided to the residents in these homes, and they failed to do so.
Well, and when you would visit your mom in the nursing home, did things stand out to you? I mean, were you able to spot some of these things?
Yes, my mother's been there for a year before I pulled her out, and almost every weekend we would have to go in there to provide care for her because there's always staff shortages. You know, we would have to go in and feed her, walk her. Basically, the place was very badly run, Orchard Villa, and to get answers from when you try to call in to speak to anyone from management, no one's ever available. You can never get anybody from management. So nobody was supervising these PSWs and workers to see that there were, you know, there was adequate, they were doing their job properly, or that, you know, there were insufficient numbers on site.
Well, and, you know, I've been reading a little bit about this home, and I've learned that, you know, over the course of the last year, a nurse was suspended, the director of care's assistant resigned. There had been a few inspections into the home. Were you made aware of all of these things?
No, I wasn't.
Okay, I want to talk a little bit about what your caregiving responsibilities are. You know, you've taken your mom out of this home. You mentioned it hasn't been easy. What does your day look like now?
Well, my day's getting a bit easier now because my mother has since cleared from COVID, and I've been getting help now from some family members that are coming to help me out so I can go to work. But you know, she's my responsibility basically 24/7. I have to look after her just like a baby, from morning, noon, and night. Clean her, feed her, give her medication, take her on her walks, exercise her, entertain her. So it is a tough job, and I feel that I feel betrayed by the nursing home and by government, because my mother waited almost 2 years to go into a nursing home, and we finally got her in because she was very difficult to deal with her dementia. And for less than a year to pull her out and to look after her, I feel is a complete breach of contract. That we're paying good money for them to look after her, and they weren't doing that. And even before this pandemic, they weren't doing a very good job, and we were constantly pulling her out.
You know, Andre, I feel like it's totally unfair that our system would download that responsibility onto family caregivers, and yet it has. What do you think?
It is absolutely unfair, the way we've just neglected our elders, the way we've treated them as disposable. Families do a lot. Families want to do a lot. They want to be involved, but there are limits to what they can do practically. And the state, the healthcare system has to be in there to fill the gaps. And there's such, our healthcare system is so hospital centric. We do all kinds of stuff for people in hospital, but then we release them into, you know, sometimes horror shows, sometimes nothing. So we really have to get our act together on ensuring care across the continuum, and care that's appropriate for what people's needs are at any given time in their life.
Miranda, would Dwane qualify for home care supports right now?
Absolutely. Absolutely. Yes, he would. And not only would he qualify for home support, but if he has trouble, he's welcome to reach out to us.
In spite of the shortages, you think he'd be able to access it?
I think that he would probably be put to the front of the list, to be perfectly honest. I know for a fact that they are putting families that have pulled their loved ones out of long-term care facilities at the top of the list right now for personal support worker care, help in the home. These are my family as well. We pulled out my grandparents from the long-term care facilities, and we're caring for them at home ourselves. At first, it was not easy to obtain a personal support worker, but now it's seeming to be a lot easier.
I know that we've tried to get, before my mother went into a nursing home, she did get personal support workers coming in, but they did an assessment, and basically we're only allowed maybe up to maybe a certain amount of hours per week. So if they did an assessment, they might say, well, maybe 4 hours a day, maximum. I think that might be the max. But my mother requires, you know, round the clock care. It's not 4 hours a day. It's basically the whole day until someone comes home. And I don't believe that they're providing that many hours for PSWs to come in. That's the problem.
Well, and after all, I mean, that was why she was in long-term care to begin with.
Yes.
In need of 24-hour care. Okay, we're going to pick this up on the other side. We need to take a short break. Our coverage continues next.
A lot of what we see in long-term care is because, you know, a lot of those informal caregivers were not allowed in long-term care, and the burden just couldn't be picked up by all of the formal care workers that are there.
Welcome back. There's no question the COVID-19 pandemic is forcing us to re-examine how seniors' care is delivered in Canada. Now, Lisa, before the break, we were talking about caregivers and the invaluable role that they play in the delivery of home care. What do you make of the role of caregivers in helping to deliver home care?
Well, there are 8 million unpaid caregivers in Canada right now that are doing this for loved ones, friends, neighbors, just trying to help out wherever they can, for exactly like the case that you're in, Dwane, to make up for some of those hours as someone goes to work, and to cover the hours that are not covered by the publicly funded home care. And unfortunately, you do need to look towards private to fill in some of those gaps, and to the unpaid caregivers to help support you right now.
What are the rights of caregivers in all of this, Dr. Young?
Well, I mean, I think, first of all, just to acknowledge the huge impact that, that caregivers have in the system, and really our system would collapse without them. And in fact, a lot of what we see in long-term care is because, you know, a lot of those informal caregivers were not allowed in long-term care, and the burden just couldn't be picked up by all of the formal care workers that are there. But there's a lot of hours that they put in. They are very attentive, to their loved ones, and in many ways provide the best quality care because they know the loved ones so much. But it's very difficult in our current system to sort of balance the rights of the caregivers versus the very significant resource limitations that are there. And often we expect much too much from the caregivers. It's not an unusual situation that caregivers are very burned out and have mental health issues because they're working so hard and so many hours. They're up at nights taking care of people. And I would say that we're not recognizing their rights enough, for sure.
I can honestly say I've personally heard stories of people giving up the best job they ever had to take care of mom, or buying adult diapers on the black market because they couldn't afford them at the local drugstore. So these things, I mean, they're completely heartbreaking. And so, when we talk about how we deliver care to an aging population, and indeed, I mean, longevity, one of the greatest things of the last century, it's a good thing that we're aging longer, but we need to be having conversations. It's not just a matter of fixing long-term care. I mean, what else is included in that, Miranda?
I think that we need to invest not only in our caregivers. I like what Dr. Young said. There isn't enough recognition of the unpaid caregiver. They work side by side with personal support workers, but we also cannot forget about the personal support worker. We knew, Marissa, prior to this pandemic, that we didn't have enough personal support workers, whether it be in home care or long-term care, to provide that vital care to our most vulnerable, in long-term care and in home care. I think we need to invest in our personal support workers. We need to invest in our caregivers, and we need to look at possibly putting home care first as an alternative to long-term care. I think we've learned something with this COVID-19, especially, is congregate care doesn't work in a pandemic. Sure, everybody might be really close to each other and you don't have to hire as much staff, but I think we have some of the best minds in this country where we can come up with a better solution to what we are currently dealing with.
Well, You know, and this isn't the first time, Andre, there's been a pandemic. I mean, every year we go through seasonal flu and there are outbreaks in homes. We've also gone through SARS, MERS, H1N1. Would you agree with that assessment that we need to be doing everything in our capacity to keep people out of long-term care? I read an interesting statistic that 20% of people in long-term care could actually have their needs met at home if there were enough supports.
Absolutely. As Miranda said, you know, we've known this is a problem forever. We have sort of this 1950s, 60s model of warehousing people, and we just haven't adapted to modern realities. You know, just really basic stuff like there should be one bum per toilet. There shouldn't be shared rooms. And we can look to other countries that have good institutional care, that have good elder care. They didn't have deadly outbreaks like this. If you look like a country like Denmark, which really takes elder care seriously, has invested massively in home care, hasn't been built an institutional bed for 20 or 30 years, they didn't have a problem because they had a system. All this pandemic has done is shine a light on these chronic problems that we've pointed out to. Everyone on this panel has pointed to time and time again over the years.
Dwane, will you send your mom back to long-term care when the pandemic is over?
No, I would not send her back, at least not to that facility. I do feel, though, that long-term care is necessary, but they do need to do a massive overhaul. And I do believe there are a lot of good person support workers that work in these facilities, and we need to invest more in them so that they can do their jobs better and pay them much better than they're being paid. I just think that this for-profit nursing homes, it should be better regulated, or the government needs to fully take them over and make sure that we look after our seniors. I mean, if these were, I think we treat our pets better than we treat seniors. I think it's pretty sad, you know. I remember the story where the tiger got COVID, and right off the bat, the workers were wearing face masks. And I don't see why this was not implemented earlier, knowing what the government knew about asymptomatic people transmitting the virus and being in a nursing home. They failed to act on that. They waited too long to implement those measures. And that's just one of the things where the government failed.
All right, we'll be right back after this short break.
If this was a daycare center, this never would have happened. If this was a dog kennel, this never would have happened. It's sad to say that, but it's true. We've put so much stock in other parts of our healthcare system that we have completely forgotten about our most vulnerable.
Welcome back. Before the break, we were discussing the future of seniors' care and whether COVID-19 will be the catalyst to finally force real change. And what does that change look like? Andre, there's been a lot of discussions around potentially bringing long-term institutional care, long-term home care under the Canada Health Act, or maybe creating a separate piece of legislation that does that. You know, where do you stand in that discussion?
Well, I think that's more of a political question. It can be a Pandora's box to open the Canada Health Act. What's important is that we make a commitment to treating elders better. How we do it is not important. It's making that commitment, saying everybody's going to get the care they need when they need it. It's going to be affordable. And the mechanism is secondary. It's getting the people right. It's ensuring the right care, the right standards, the right training, the right oversight. And that can be done in any number of ways. There's not one way to do this.
You know, Dr. Young, do you think that there needs to be national standards?
I think national standards would go a long way to helping us identify some of these problems. Of course, healthcare is a provincially sort of organized infrastructure, and so I don't think that it would be able to end there. And you know, there's very specific things that we would have to take into consideration for different geographies sort of across the country. But what I do think is very necessary is to examine, where the role of acute care starts and stops, and where the role of long-term care and home care sort of picks up. And traditionally, we've had a system that is very embedded in the Canada Health Act that really emphasizes the acute care system, and that was our default when this pandemic came, is that we said, okay, we need to mobilize all of our acute care resources. We need to empty out the hospitals. And what we're learning now is that there's very hard price to pay for those types of decisions, because there's another population that gets very neglected, and they're not well looked after. And so I think we need to learn how to balance the needs of both sides of our system. And in fact, having a system outside of the hospital that's better functioning will actually make our hospitals work better, because they'll be able to focus on what they're good at and what they were designed to do.
Miranda, the Prime Minister has chimed in on this discussion, and it's very rare for the federal government to comment on, provincial matters. Of course, long-term care falls under that. Do you think they need to come to the table?
I think they do need to come to the table. I think that the federal government, working with every province, needs to come up with a solid plan to protect our seniors. I mean, one of our panelists said earlier, if this was a daycare center, this never would have happened. If this was a dog kennel, this never would have happened. It's sad to say that, but it's true. We have put so much stock in other parts of our healthcare system that we have completely forgotten about our most vulnerable. And these are the people, the individuals that built the society we live in today, and they deserve more. And we really need to make that commitment to give them what they deserve.
And they do deserve more. And advocates have been, raising alarms for years, and yet here we are, Lisa. I mean, what's this all rooted in? Is it ageism?
I wouldn't say ageism. I would just say they have dropped the ball when it comes to home care, and have dealt more with acute care and the larger issues brought up to their attention first. This has been ongoing. We've been advocating for years for the need for better pay for our PSWs. We also need more investment into the health, human resources, retention, training. It needs to be put out there, training grants, and also just an awareness of the need for this part of the healthcare sector.
Dwane, are you hopeful that COVID-19 is that catalyst that affects real change?
I really do hope so. I think with all the media attention that's being placed on long-term care homes, the federal government chiming in on it, I think that change is going to come. And I think that's going to be better for everybody in the future, including us as we're getting older. We got to think about that.
As we take a step back, what are some of the biggest lessons that you think can come from this, that we've learned from this pandemic? Andre?
Well, I think it's what you mentioned. I think there's this institutional ageism, this neglect that's built into the way the system is structured that we have to deal with. We have to fundamentally change this hospital-centric system that just cares about acute care and doesn't care for people who are chronically, have chronic degenerative diseases like dementia. They need more care, they need a different kind of care, and they need a different system that's about the person and not just about a specific illness that they have.
Miranda, what about you?
I think that we've learned that we have not invested enough in our long-term care system. I think we've realized that the personal support worker was the invisible worker for as long as I can remember on the front lines, not only in long-term care, but in home care. And now we're realizing that we need them more than ever, and we don't have them. So that's been a wake-up call, I think, for many Ontarians. And I think that we've realized, too, that we need to invest more in our seniors. We need to invest more in our system, period, when it comes to our elderly.
Dr. Young, I see you nodding your head, and as a geriatrician, you're on the front lines and you're working with seniors every day. What do you hear from them?
The same kinds of things that we're talking about today. And, I think that long-term care is really a symptom of the bigger problem, and people feel it every day, where we're not putting enough emphasis on the overall care of our older adults. And they're a very valuable part of our population. We need to really recognize that. We need to make that front and center. We need to spend the time, and we need to spend the money to really do it properly, give people the training so they can succeed doing those jobs. And if we look at it as a continuum where long-term care is only one piece of that bigger puzzle, then I think we can be more successful. The problem is, as long as we keep breaking it up and looking at sort of, individual little problems, then we're never really going to get the whole thing right. And we're going to continue to stumble over the same kinds of problems that we're dealing with today.
Well said. All right, we need to take a short break. More when we come back. Welcome back. It's that time in the show for final thoughts from our panelists. We'll start with Miranda.
Thank you, Marissa. I think this has been a wonderful discussion. I think that our society here in Ontario and across Canada have now realized that we need to invest more in our frontline personal support workers. We need to invest more in the entire healthcare system in order to care better for our elderly and prepare it for us who are coming down the pipeline.
Andre.
I think very similar to what Miranda said. We're all going there, right? I have the white hair. I'm on my way. We're all going to need this care at some point. We should not tolerate anything for anyone else that we wouldn't want for ourselves.
Dwane.
I echo those same sentiments. I feel the same, that we need to invest more in long-term care, and we need to get away from the for-profit homes, because that's driving them to not look after the workers and the residents the best they can.
Lisa.
I agree with everyone. We fully need an integrated care system, work on the entire continuum from physician to PSW, from our 8 million caregivers. Everyone needs to be included and the patient needs to be center.
And finally, Dr. Young.
Yeah, I agree. This is a problem that's going to need all hands on deck. We need everybody involved, from the patient and caregiver right through to every type of healthcare professional. We need a bold vision. We need action. And people keep telling us over and over again, they want to be at home as long as possible. And in fact, we can deliver better quality care at home. We can do it for less expense. And we just need to have the vision and to be able to do it, because it just makes sense for everybody.
Well, there really is a chorus of people saying the same thing. And so hopefully, now is that time where our leaders do listen. All right, that's all the time we have. A big thank you to my panelists for your expertise, and of course to our audience at home watching. We'll see you soon.